Today we are going to be looking at the Aircast Cryocuff cold compression device this device pumps ice water from a cooler to a compressive sleeve to both cool and compress the surrounding surgical site. This device is used to reduce swelling, pain, and hemarthrosis in post-surgical knee patients. The device costs $125 and can be bought on hattricksports.com. It is indicated to use this device to be used after a patient undergoes knee surgery along with excessive swelling and pain around the knee. It is a portable device and can be used in the patient's home, and it is also FDA approved. It utilizes a standard 3-prong plug and requires 120 volts to function appropriately. This device is never to be greater than 15 inches above the cuff around the knee during treatment to avoid excessive pressure within the cuff. To use this device, we will first fill the cooler with ice water, which we have already done here. Second, we will apply the empty cuff to the knee. Third, we will lift the cooler above the cuff to fill it, making sure not to bring it more than 15 inches above as indicated before. Fourth, we will place the cooler on a stable surface that is level with the cuff. And fifth, we will plug in the machine to begin circulation of the cold water.
So before we apply this device and begin therapy, there are a few things we need to make sure our patient isn't contraindicated towards. The first of these is Raynaud's disease. The next is peripheral artery disease, arteriosclerosis, cryoglobulinemia, infections in the area, any cold allergies or hypersensitivities, as well as any other sort of clotting disorders. These can easily be found out by a few simple questions posed to your patient. So real quick, what I'm going to do is have my patient Katelyn here, and we're going to show just how we would apply this. So hi, my name's Zach. I'll be your therapist today. Hi. So what we're going to be doing today is we're going to be applying some cold therapy to your knee, and it'll actually be a compressive therapy to kind of get some of that swelling out. So if you'll go ahead and put it here, we can go ahead and get started. But before I hook any of this up, there's a few questions I want to ask you. All right, if that's right with you.
Mm-hmm.
All right, so the first one I have for you is, have you ever been diagnosed with Raynaud's disease?
No.
Do you have any sort of blood disorders or clotting disorders?
No.
Do you have any active infections in the area?
No.
Have you ever had any adverse reactions to cold before?
No.
Have you ever had frostbite?
No.
And is there any other health information you feel like I should know about?
No.
All right, so I'm going ahead and apply this if that's all right with you.
Yeah.
So I'm just going to put this lightly around the knee. The next step is to lift this up so cold water will flow into the cuff and fill it. So once the water's in the cuff, we then simply set it at a level surface and then plug it in, and it will begin to pump cold water into the cuff. So throughout this therapy, you'll alternate between having higher pressure water in there and lower, so that'll help to push the swelling out. And as it's going, we're going to leave it on for about 20 minutes. You should feel a variety of sensations. The first one will be just an intense cold feeling. After that, you might get a little bit of burning or pins and needles feeling. Then you'll get a little bit of an ache, followed by numbness in the area. If any of this becomes too uncomfortable for you, feel free to take it off or let me know. And this is something you can do both here in the clinic and then back at home as well.
Okay, so since this device can be used at home, it is important to let your patient know of some extra precautions. First, tell them to regularly check their skin for areas of possible burns, blisters, frostbite, etc. And if any of these arise, to discontinue the treatment and consult a medical professional. Second, avoid prolonged use. Third, to avoid electrocution, always have a cooler on a stable surface. Fourth, always use as directed by a healthcare professional. And fifth, make sure to regularly clean the device and do not submerge the lid into water, as this is where the electrical component is located. Now some research on this device. In a study done by Kohlenberg et al. In 2006, it was found that patients that use cold compression devices after surgery had a decreased swelling and increased range of motion compared to a control group who did not receive treatment with cold compression devices. In a review done by Block in 2010, which reviewed over 40 articles about different types of cold modalities, found that patients who had ACL reconstructions who used cold compression versus standard ice had better range of motion, reduced pain and swelling, and better overall function in the short term. Throughout our research, we did not find any downsides to this device. However, we do feel that it is an expensive modality for the average person to purchase. Overall, the current research indicates that the use of cold compression is an effective modality to decrease swelling and pain.